1/3. We can do away with 1/3 of your cancers. How do you do that? You quit smoking. As a nation, you quit smoking. That's 1/3 of cancers is caused by tobacco. 1/3 or nearly 1/3 of heart disease is caused by tobacco. Nearly 1/3 of respiratory disease is caused by tobacco. And globally, tobacco will account for 1 in 10 deaths by the 2015. That's 1 in 10 of all deaths. So we have to eat. We don't have to smoke. So Japan needs to step up to tackle tobacco. This is we have all of the evidence that we need on how to do it. We know exactly what we need to do. It's a question of political will. And that's a message you need to take to your government, the majority share owner in Japan Tobacco. Creating a national NCD alliance, I think, would be a great start to focus debate. I thank the Institute for bringing us here today, but connecting the people involved in prevention and disease control nationally is important, because civil society must put that pressure on to governments to take the right steps in the international arena. Certainly in the political declaration, there are deadlines coming up. Next year, member states must decide on targets and on the potential of a global partnership and a monitoring framework. In 2013, all member states should be reporting on their national NCD plans. In 2014, there will be a high-level review of progress made since September. Anything that happens at the UN needs Japan's support. You can both make things happen and you can stop things happening. Because, as you know, you are, I think per capita, you are the biggest single donor to the UN system. The second biggest overall, but in per capita terms, you are the biggest single supporter of the UN system. So you can really make things happen, or you can stop things happening. So we'd really like to see you make things happen, and that means looking to the providing leadership for the review, supporting the integration of NCDs into the next development goals, and discussions about that, they're starting now. So we met with UN agencies a couple of weeks ago, and the Secretary General has appointed a task team across each of the UN agencies to talk about what happens after 2015. So we need to be part of that discussion now and make sure that the same mistake doesn't happen again, that NCDs are not left out of the development picture. But you've already made a good start. I had a meeting yesterday with colleagues from JICA, and I was thrilled to find out that you are already funding work on NCDs in developing countries. And this was noted at the summit, where in their statements, 2 countries thanked Japan for their support, and that was Sri Lanka and El Salvador. And I learned yesterday that JICA has been supporting Sri Lanka in the development of their national NCD plan since 2008. So congratulations. You're one of the few countries that actually has invested. It's modest, but it would be great to see the leadership from Japan with the other bilateral agencies to persuade them to start working on NCDs now.
ありがとうございます。時間がちょっと過ぎてしまいましたので、私ので簡単にまとめたいと思います。一つは日本においての NCD アライアンスをやはり構築が必要だというふうに、これは大きな宿題をいただいたかなと思います。これは本当に皆様のご協力なくしてはできないと思いますし、疾病横断でいろいろ取り組んでいけることが 多いのではないかなということが一つ。そしてもう一つは、ジュリーさんおっしゃってましたけれども、日本は国連の拠出金、大変多くのお金を出しています。我々の血税でもあるわけです。これに関して、ただ傍観者としているわけではなくて、やはり積極的に世界に対してコミットしていって、貢献をしていきたいというのが、私自身も強く感じたところです。一つ、最後に思ったんですけれども、とはいっても9月19、20という日程、皆さん覚えていらっしゃいますでしょうか。実は NCD 国連総会にはですね、我が国の大臣級もしくは首相級の方は残念ながら参加されませんでした。なぜならば直前に首相を交代したからです。これも我が国が抱える大きな宿題かなということを最後に申し上げて、イギリス式のティータイムがそれで待っておりますので、15分弱休憩としたいと思います。井上さん、ジュリーさん、本当にインサイトフルなパネルをありがとうございました。
それではパネルディスカッション、各セクターの果たすべき役割、グローバルパートナーシップに向けてを開始いただきたいと思います。本セッションではさまざまなお立場でご活躍の皆様にそれぞれのお立場からの日本の NCD 対策の在り方についての考えをお伺いいたします。ご登壇者をご紹介いたします。厚生労働省大臣官房審議官国際保健担当麦谷雅人様、製薬団体連合会会長デイビッド・ブレナン様、東京大学大学院医学系研究科内科学教授永井良三様、アメリカ・ワシントンからお越しいただきましたランス・アームストロング財団のディレクターロイス・フェイス様です。モデレーターはハーバードビジネススクール日本リサーチセンターシニアリサーチアソシエイトの山崎舞香様です。それでは山崎さんよろしくお願いします。それでは第2部のパネルディスカッションを始めさせていただきます。先ほどご紹介がございましたけれども、私ハーバードビジネススクールの山崎と申します。なぜビジネススクールのものがここにいるのかということなんですが、ハーバードビジネススクールで働きながら今現在東京大学の方でグローバルヘルスリーダーシッププログラムというリーダーシッププログラムの運営に関わっておりまして、またこの日本行政機構とはもう7年以上にわたる設立の当時からのサポーターということでずっとお付き合いを続けてまいりましたので、本日このような場でちょっとお手伝いさせていただくことになりました。よろしくお願いいたします。今までのところで NCD とは何かということと、それからそれに対して、特に日本が何をすべきなのか、何ができるのかという話が、基調講演、それからパネルディスカッションの方でございました。第2部の方では、それを踏まえまして、各セクター、本日ここには、製薬協会の方、それから日本政府の方、日本の医療の現場で、教育にも携わっている永井先生、そしてシビルソサイエティの方でずっとがん対策をやってこられた方と、各セクターを代表する皆様にお集まりいただきましたので、それぞれのセクターの、果たしてきた役割、これからやろうとしていること、それを踏まえてさらにセクターを超えてどのようなパートナーシップが築けるのかという、そういう話をしてまいりたいと思っております。では初めにですね、先ほどから9月の国連のハイレベルミーティングの話が何度も出てきておりますが、実際にその場に日本代表として参加をされました厚生労働省の麦谷様にまず質問をさせていただきます。まず先ほど大臣クラスの方が日本からはいなかったという話がありましたけれども、そこの会合で得た印象と、それからその会合を踏まえまして日本政府として現在NCD 対策に対して何をやっていらっしゃるかというお話の2つをいただければと思います。
First of all, thank you to Judy and Hajime. We have received a sort of the clear picture of the current NCD situation. I will elaborate a little bit in terms of global health. First of all, as she already mentioned, I attended an NCD high-level meeting to be held in held in New York in September 1920s, if I'm correct. At that time, I was a representative from Japanese government, unfortunately. Somebody already mentioned that 130 countries attended to that high-level meeting, which was the big side meeting of the UN General Assembly. And the main General Assembly, of course, the Prime Minister, Noda, Mr. Noda, attended as a Japanese delegation, head of delegation. But I think, that's my personal view, there were two reasons the minister or Prime Minister couldn't attend to that meeting. One is very clear, that Mr. Noritake, I told you, the new government was created in August, and that New York meeting was held in September, mid-September. So it's difficult to make preparation for both a even Minister of Health, because we need some backup system for her. And she was, our minister, the female, Madame Komiyama, who was the vice minister before government. And she was appointed as minister. And continuously she was working in our ministry, but still she needs some preparation for the New York Assembly. And that is one reason. The government doesn't have enough time for the preparation. That's one thing. Second, this is our daily headache. When we try to ask our minister to make a duty travel to abroad, such as New York, we need permission from two ways, from two authority. One is the Chef de Cabinet in the Prime Minister's office. Second, we should receive the permission from Japanese Diet, in this case, Assembly. That's a lot difficult. When Japanese Diet is open, they couldn't make any permission for us to release minister to abroad. That's a big problem. It's a daily headache. Even, for example, this coming December, we will have a G7 health ministers meeting to be held in Paris. And we asked Japanese Diet several times to release our minister, but they couldn't. They didn't come up with a good result for us. So that's the two things. So in view of the non-communicable diseases, we are now thinking about NCD as a kind of the package. But actually, the content of non-communicable disease is not so simple. It is complicated. As you know, some already mentioned, there are more than 4 diseases: cancer, hypertension, pulmonary disorder, and also the cardiovascular diseases, and diabetes. So the content of the non-communicable diseases are not so easy, not one single disease comparing with the infectious disease control. So those are difficult to control and also difficult approach to all the diseases.